I'm going to go next Friday. And watch this. And I got to put my hand over my eyes. Danny, I'm putting my hand over my eyes. I'm going to the Mar Cosmetic Medical Center. I'm going to do it. I'm going to get my love handles taken away. I'm going to do it. I went yesterday and I saw Dr. Sherman. He was really cool. Hey, I worked my ass off to get to this position where I'm at right now. I worked 26 years of my life sculpting my body, and it fell apart in 10. And I asked him, can I go to work on Monday? He goes, absolutely.
Man, I'm ready to roll. I could have a martini. By the way, he's making me one right now. He's getting ready to make me a martini. Nice with booties, too. Everybody from Los Angeles to San Diego's like, all right, Sileo, what the hell's going down here? Basically, what you're going to feel is just, you know, a little needle stick, 2 seconds of a little burn, and then we'll start the infusion, which you won't really feel, which will start the numbing process. And, you know, once everything's all numbed up, we're going to go in and remove that stuff. That's fine. Do you have time to go to the first, do you have time to go to the first home game back here with the Chargers? You ready?
Yes.
It's working okay?
Mm-hmm. Okay, on.
On?
Okay.
You know what it feels like? You're pulling tape off.
Uh-huh.
See, it feels like you're pulling tape off.
Okay, now this is our Vaser, which is our emulsifier, our ultrasonic emulsifier. And this is our relatively brand new probe that has 5 rings on it, you can see. And what that indicates is that the ultrasonic energy is really coming out much more effectively into the fat. And what the energy does is break up and loosen, not to break the fat cells, but loosens the fat cells from their connective tissue structures, so that when we suction it, it comes out that much easier and less traumatically, because it's already been loosened with this instrument. So you hear that hissing?
Yeah.
That's the actual ultrasound. It's vibrating at thousands of times per second, creating the ultrasonic wave. And when it makes contact with some wet tissue, it tends to hiss a little bit. You need to know exactly where the end of that probe is, and you can feel that probe advancing into the tissues. What this does is loosen the fat even more. So it breaks the fat up. It's a fat disruptor. And we use it both before we suction and after we suction to help smooth things out. Do we have our suction on?
Yes.
Suction should be on.
All right.
17. Let's see.
Really?
Yeah.
Isn't that cool, Dan? All that fat coming right out.
Is that really fat?
It's, yeah.
Well, there's a lot of fluid, but there's a lot of fat in there too.
That's wild.
Right now we're doing the body contouring, removing the fat, and of course I always tell patients it's not how much fat we take out, it's what we leave behind, because what we're aiming for is a good body contour. So in 1992, Dr. Klein, actually in San Clemente, worked out the safety aspects of doing it with this technique, and that really revolutionized the liposuction. Before, we never really would attempt to do this with you awake like this.
Trust me, I've seen a lot worse.
Yeah.
In surgeries.
Like your knee?
Yes.
Now we can take the fat and harvest the stem cells, and then use the stem cells in myriad ways. You know, they're actually injecting it into joints, for instance, to help stimulate new collagen production and to help reline the joint. Now that's not well. You can see we finished that flank area, and the fat's starting to separate. But we have about maybe 1,300 cc's of fat, a couple hundred cc's of what we call infranate, and it's blood stained, but it's very little blood. That's mainly fluid. So this was a pretty decent out of one area. So this is a pretty decent extraction.
Hey, after today, what's your name, hon?
Misty.
Misty. We're all family.
Boys.
Absolutely. All seriousness, it's been a great, wonderful experience. I recommend this for every single man over the age of 40 when you now start to see his metabolism go down, doesn't have a chance to get into the weight room as much.
Yeah, you can come around here and you can start seeing how that contour is looking. We're going to smooth out a little bit of
Definitely better.
Asymmetries here, a little bit of fullness here, and he's going to have a nice contour to that love handle area. We're here with Dan Sileo, who is now 12 days after his liposuction of his love handles, which was done under a mild oral sedation and tumescent anesthesia, which means he was awake for the whole procedure.
Yep.
We were talking, he was telling me what kind of music to listen to.
Yep.
And how was that experience?
You know what? At first, you're first apprehensive about any surgery, but then, you know, after you have the people that were around you, you could tell the experience. And as I went through the process, by the end of the operation, I completely was at ease. And I got to tell you, too, it was a lot easier than any of my knee surgeries. I'll just say this, that I ever had, and it was really something of an experience that, you know what, I didn't know what to expect because I hadn't been through anything like that. But it wasn't really anything because, like you said, I mean, I got home that night. We had some drainage, and as it's dissipated over the last couple days, I would say actually the first 3 days, but after that, it really kind of goes down to like little tiny dots.
Yeah.
That were on the cushions.
Yeah, that's the tumescent fluid that's coming from the small openings where we put the anesthetic agent in, and where obviously we also entered the area with our little suction cannulas or tubes to remove the fat. So during the procedure, did you have any discomfort that you remember?
Nope, not at all. You know what? There was no pain at all, except again for a little bit. The first night you have to get accustomed to having the girdle on and sleeping in your bed, and after you get into a position like now, it's all good because it's just finding a comfort zone that first night. And once you do, putting a pillow under your arm here, putting a pillow here, then it was totally more just, you know, hey, you had the surgery. And as the days have gone on, it's just been absolutely easy for me, especially when I went back to work that Monday. I mean, I sat in my chair. I was like, geez, I don't know, because it was Sunday. I'm like, am I going to be able to sit there? And I sat there just like anyone would at their office.
So that was just 3 days after surgery then?
Yeah, I mean, like anybody would be sitting at their office, salesperson or anybody, let alone just me sitting there. And there I was sitting there doing all my work, got up. I really didn't have any kind of issues whatsoever. I have people telling me already when I was at the ball game, they noticed it already. I mean, I had the garment on, so it was hard for them, but I told them, I'm like, hey, I'm wearing a girdle here. And I got this thing on, and I lifted it up, and even Billy Ray Smith and all them guys are going, that was good.
So we were able to get some post-operative pictures today on Dan, and we're going to show those to you. But Dan, can you tell the difference between the before and after?
Unbelievable. That is unbelievable. You must have taken 5 inches off of each side. Has to be 5 inches off of each side. And I would say this too, because I would probably be saying that I'm a little bit swollen, and that's probably going to go down a little even more.
Yeah, that's exactly what I was going to say. That the tissues are still thickened and swollen. We call it indurated. But over the next 3-4 months, we usually don't take pictures until about 2 to 3 months because we know that's going to happen. So actually, you'll look even better. Okay, very good.
Thank you.